Okay.
Ready?
Excuse me. Do I know you?
Yes, it's Mr. Roberts.
Okay, Mr. Roberts. Hello, Mr. Roberts. It's good to meet you again. How could I help
Hello,
you?
hello, doctor. Hello.
Hello.
This pain is killing me, doctor.
Oh.
It's always been there, but these few days it's
Mm.
so bad, and I have difficulty walking about. I have difficulty getting up from the chair, and it's really getting worse.
Oh, I'm so sorry to hear that. Then you said that it has been worsened in few days, yes?
Yes, maybe a week even.
A week. Could you show me the exact location of the pain?
Yes, it is in the joint in my right hip. Yes, there.
Okay, on the right hip, yes, not your
Yes.
left hip.
No, this
Oh,
one is so it's my bad side, It's and I'm
okay.
using a walking stick. And do you think this
Oh,
means that I'm getting old?
no, not at all. Mr. Robert, does it, do you have taken any medication for that?
No, I haven't. I took some paracetamol. It doesn't actually help, so I just
Oh,
left
it
it.
doesn't. Oh, okay. And do you have you seen any readiness in that part?
Redness? No, no, there's no redness.
Okay. And is it when you put your hands on the location, is it heat? Is it warm? Is it warm?
No, not really. It's I'm always warm. But yeah. Do you think it's serious, doctor? Is it arthritis? What is it?
We will do some tests on you, and we will exactly know what's the problem with your hip. But if you don't mind, I'm going to ask you more questions, Mr. Robert, and again we will again discuss about that. Is it okay?
Yeah, we can discuss it later. Okay.
Yeah. Mr. Robert, tell me more about your exercising habits. Have you put more pressure these days on your hip?
No, it's just my weight. So
Hmm.
I'm a big man. So
No.
just walking
Oh,
is exercise for me.
okay, okay. Then it's the same as always.
Yes, I haven't done anything different.
Oh, and you are 76 years old.
That's right.
Okay. And Mr. Robert, please let me to know that if I have understood you correctly. You have come here because of your right hip pain, and you had it from before, but for a week it has been worsened, and you haven't put any more pressure these days from and of course there is some and you send some warmness on that location. Is it okay? Is it right?
Yes, right. Yes, correct, doctor. You got it all right.
Oh, yeah. Okay. And I'm going to examine your hip. Is it
Okay.
possible?
Yes, sure.
Yes.
Yeah.
Okay. Okay. I feel some warming here, and I think, but there isn't any swallowing here. Okay.
And it's
When I um, move your hip, do you have any pain right now?
yes, when you push it forward and upwards, yes, it does hurt.
Okay, 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 Mr. Robert. It's a very common complaint in when people in these ages. It's a common problem, and I assure you, don't. There's nothing to be worried. But I'm glad to say that there are some ways we can reduce your joint pain and discomfort. And I think there are some possible causes for these symptoms, and the most common of that is arthritis. Do you know anything about arthritis?
Yes, it sounds like it's something that doesn't go away. And so why do you think that pain is getting worse? Is arthritis getting worse?
Yes, of course, because by aging, the cartilage between two bones in our joints get reduced, and then two bones touch each other more often, and it's the cause of your pain. But the good news are that we can help you, and we can reduce the speed and the progress of this condition. Is it okay?
Okay, okay. So what should I do now? I mean, is what is going to happen now?
Okay, I will tell you. Mr. Robert, first of all, we need to do some X-ray for your joint to know that if it's arthritis or tendonitis or bursitis. Bursitis means that the inflammation of the some sacs that are located between our joints, between our bone, and there are maybe it's bursitis or tendonitis. By X-ray, we will know that. And also, Mr. Robert, I want to discuss other treatments for you if it's possible. Do you agree?
Well, I that was lots of itis, doctor, but okay.
Yes. The best treatment for you right now is reducing your weight. You know, weight loss is and modification of activity. Weight loss is the most important factor in treatment of arthritis and reducing the progress of that. And
Right.
I will help you by that. And I will arrange some, nutrition consultant for you to help you to reduce your weight. And the other thing is, you said that you use paracetamol and it didn't help, but I can prescribe you some Voltaren cream that will help you by the pain, and also physiotherapy. Physiotherapy will help you to strengthen your muscles, and when your muscles of around your joint get more strength, then the pain will decrease. How sounds to you? How that
Mm,
sounds to you?
okay. Yeah, if I remember all that, doctor, thank you.
Oh yeah, I will tell you again all of them.
Okay.
Don't worry.
Thank
Okay.
you. Okay. Thank you, doctor.
Okay.
Thanks. Bye.
Thank you. Do you have any other question?
No, that's it, doctor. Thank you.
Okay, good. Bye. Bye, Mr. Robert.
Bye. Bye. Okay.
Bye.
So, how does that feel?
Doctor, I think it was good, but I should say that I ran out of time. I ran out of time, and I only come until giving information, and I couldn't uh, did it completely.
Okay. So it
Mm.
was, you feel like it was good, but you ran out
Yeah.
of time. Okay.
Yes.
Okay. What did you do particularly well? Do you think which part you did very well?
Mm. I think I made a good rapport with patient,
Okay.
and yes, and the other thing, exploring the eyes. I try to say that don't be worried, and he was worried about that it will be get worse, and he need that stick for a long time. But I
Okay.
said that we can help you, about that, and in gathering information, I think it was good. I tried to ask all the aspects of the complaint and the symptoms and ideas of the patient.
Okay.
Mhm.
And the structure, do you think it was structured?
Um, First of all, yes,
Okay.
not completely. It could be more better, doctor.
Okay. It could be
Mhm.
better.
Yeah.
Okay. So how about anything else do you think could be done better?
I had some hesitation, doctor. I
Mm-hmm.
couldn't find the word warm in my mind, and I wanted to say heat.
Okay.
I had some hesitations,
Okay. Anything
but
else?
I think I was fluent.
Okay. Good.
Mm.
So, okay. How about the others? What do you think?
Yes, doctor, I think it was good. Did well in report. It was very good. I think in gathering information, asked so many questions. Maybe we should
Yeah.
choose less questions. And in summarizing was good. Chunking checking was good. And in examination, I think we don't need to perform an examination in front of the patient. And I think there was the cause of the running of time.
Yeah,
Other and
okay.
some um, jargon, jargon,
Yes.
jargon. We
Mhm.
have some jargons, cartilage, and some sort of thing. Other thing I think was good.
Okay. Okay, some uh,
Doctor,
jargon.
what did they say to cartilage?
Good.
Tissue,
Oh, cartilage.
tissue, Dr. Nilu.
No, we say cartilage. Yeah.
You say cartilage.
Yes.
I try to explain about bursitis.
No,
Uh,
that is, those are basically bursitis, arthritis, and these anything with itis is actually anything other than arthritis is doesn't make sense to people.
yes.
Okay, right, good. Anything else?
But doctor, I think the define the bursitis and tendinitis. I think isn't that okay?
It's too much to
Too
take
much.
in,
Yes, yes.
Right. Okay. Right. So we're not talking about differential diagnosis with the patient. The patient's concern is arthritis. We want to say is it arthritis or is it not? Um,
Doctor, why did they have said in the task?
Yes,
Because
sorry?
it
of
is a long
the
task
said,
Yeah,
in the task it said,
mentioned. Yes.
it is mentioned.
including obstruction mostly, yes.
Including, sorry?
In the first task, explain possible causes of the symptoms, various including osteoarthritis, most likely bursitis, tendinitis. Because of that, I explain for the patient.
Okay. All right.
Hmm.
Mm, okay. Yeah, but that takes a lot of time.
Hmm.
Okay. Uh, right. Yeah, it's actually it's probably too much to explain bursitis. I mean, if, for younger people, I do that. I explain. I draw a picture. I say this is bursa or this is tendon, and these
Yeah.
can. It's not just the joint, but everything around the joint can become uh, bruised. Okay,
Mhm.
from 7 to 6 year old. Okay,
Doctor, do
right.
they know
Yes.
what's the inflammation or it's a jargon?
We don't say inflammation. We the lay people usually say bruised.
Oh,
Okay,
bruise.
bruised.
Okay, then
Yeah,
we use bruise because
yeah.
bruise.
If you say inflamed, they can understand. But if most of the people say it's bruised. Then again,
Oh,
it is inflamed. Okay.
okay.
Um, right. Anything else? Uh, what do you think?
I think was
because the task was too long and their management of time is very hard for us. But I think in the first part of the conversation, when the want to have a communication with the patient, can communicate better. For example, when see the patient come with sick, it is better to say, please sit and uh, and are you comfortable in your situation in your sitting like this? And also about the asking about the worsening of the symptoms, can
Yeah.
say that we can manage it with decreasing your weight, with weight loss and modification your activity and something like this, physiotherapy and like this. And about the end part of the task, that the patient that said it is very hard to remember all the things that you said,
Mhm.
she can say, I review it again for you and I give you some pamphlet or like this that help you to remember what you want to do.
Mhm.
Okay, good. Yes. She did mention weight loss and change in your lifestyle. But yeah, I think when it's too much, the patient cannot remember, so you need to give them a
Yeah.
leaflet. Also, I think what you didn't actually do was chunking, really. You gave a lot of information in one big chunk. And didn't check. And that's why the patients, especially older people, get quite confused in remembering all that. Okay, yeah. I mean, overall, I think it was good. You were more fluent. Having said that, you do have, I think you do have some mistakes. Right. Um, Let me to note that. No, not let me to note. Let me note that, or let me tell you. We don't say let me to note that. Let me tell you something. Uh, it has worsened, not has been worsened. Okay.
Okay.
Warmth. Have you felt any warmth or any heat? Um,
Oh, verbs.
Warmth. Yes. Uh,
Doctor, heat is a noun also.
yes. Yes.
Heat
Do you
and
feel any
verbs.
warmth or any heat? And swallowing?
Swallowing. Not. Swallowing means gurtladan. This is tavarrum.
Yeah. Swelling. 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 Okay. Yeah. In this age, what is that?
Yes, I know that it's sometimes with a judgment. It was, I want to say that by aging.
Okay. Right.
It's
In this
judgmental
age,
to
right. In this age means in
in
this era, in this period of time. When we use in with age, it means the age of, for example,
oh,
the 20th first century or something like that. And at this age, you could say, and
at this age,
yes, at this age. We don't want to say, but you said by aging.
by aging,
We don't. Well, you said by aging, but we don't want that. We actually want to say as time goes, or
as
as
time
uh,
goes.
yeah, as time goes, or as time passes. And strengthen, not a strength. To strengthen means to make it stronger. Okay, you need to strengthen your
Stronger
muscles. Or
mhm,
physiotherapy will strengthen your muscles.
muscles.
Um, okay. Can you say again? Sorry to hear that.
I'm so sorry to hear that.
Okay. Um, any other way you can say it?
I'm so sorry to hear that. I'm so sorry to hear that.
Okay. Right. Um, if you're sorry, do you shout or do you say it
So
slowly?
sorry to hear that.
Oh, sorry to hear that. Sorry
I'm
to hear
sorry.
that. Okay.
Mhm.
So you need to lower your voice. Oh, sorry to hear that. It's like you speak to a baby. You say,
Mhm.
"Oh, bien kuchulu kuchulu," okay, like that.
Mhm.
Okay. Sorry to hear that. Oh, sorry to hear that. Okay. So the way you say it shouldn't be rising intonation. So you don't say,
Mhm.
"Oh, sorry to hear that." No.
Mhm.
Sorry to hear that. Okay. Good. Um, right. And don't be worried. No, don't worry. Okay.
Mhm.
We don't say don't be worried.
Mhm.
Right. Any questions?
No,
Right.
doctor, thanks.
Okay. Well, one of the reasons you ran out of time was that I think, as I mentioned, I think you were asking too many closed questions. Okay.
Yeah.
Which basically you speak a lot and the patient says yes or no.
Mhm.
So instead, if you give the patient the opportunity to talk, they might actually give you a lot of your answers. And the other thing is, and you need to listen to them. And they have, I mean, he already told you that he's had this pain or something, and for a few days. And then you ask that question again, okay?
I wanted to show that I have heard that,
So
and I have
you
pay
you do that
attention to him.
you do that in summarizing, okay?
Okay.
Okay, you don't question again. So
Okay.
if the patient tells you something and you keep asking the same just to show that you have heard them, no, it doesn't make sense. They
Yeah.
actually they think you don't listen to them. So
Mm-hmm. Yes.
well, that is what summarizing is for. You tell them that you have understood.
Mm-hmm.
Okay, and in
Okay.
summarizing, you need to be quicker. Basically, you shouldn't hesitate too much, and you shouldn't pause too much. You need to summarize quickly and just say, okay, so you said you've had this for a few days, maybe a week, and it's getting worse. You haven't done anything different, and you've taken some
Mm-hmm.
paracetamol that didn't work. Is that right?
Mm-hmm.
Yes, that's right. Okay. And you think it is arthritis? I think it is arthritis. What do you think, doctor?
Mm-hmm.
Right. And then after that, you could say that, yeah, it is most possibly, it's very likely to be arthritis because um, a very good word you can use is wear and tear. Okay.
Mm-hmm.
Have you heard of
Yes.
that? Wear and tear. And wear and tear means when you use something, it actually gets older and it goes out of order, basically. It doesn't work properly. So it's very common to say, I mean, people say it's wear and tear. Um, and yeah, for inflammation, you can say that it feels bruised or it might be bruised. Uh, of course, bruise in medicine means what do you call
Cab.
it?
Cab.
Kabudi or yeah, something like erythema. But yes. Okay.